Shortness of breath can be a daunting experience, compromising the quality of your daily life and rest. While there are various causes and treatments for this condition, simple adjustments in your sleeping position can make a significant difference, which is why exploring optimal sleep positions is crucial not just for those diagnosed with respiratory conditions, but also for those who occasionally experience breathlessness while trying to fall asleep. And that is the topic of this video. So keep watching to learn about the benefits of various sleeping positions, providing guidance on how to achieve a restful night without experiencing shortness of breath. So, if you're ready, let's get into it. In general, elevating the head and upper body by sleeping on an incline or using extra pillows can help alleviate shortness of breath. This position aids in reducing diaphragmatic pressure and improving lung expansion, facilitating easier breathing. Side sleeping, particularly on the right side, may also benefit some individuals. But to get a bit more specific, now let's dive deeper into the best sleeping positions to avoid shortness of breath. Number 1, as previously mentioned, is sleeping with your head elevated. Elevating the head and upper body while sleeping can aid in easing the symptoms of shortness of breath. By using a wedge pillow or stacking multiple pillows, this position facilitates gravity's assistance in reducing pressure on the diaphragm, enhancing lung capacity, and making breathing less laborious. This method is particularly beneficial for individuals with conditions like acid reflux, which can exacerbate the symptom of breathlessness. Number 2, lying on your side with a pillow between your legs. Sleeping on your side can help open up the airways and optimize lung function. Placing a pillow between your legs ensures proper spinal alignment, which indirectly can promote freer airflow. This position might be especially beneficial for individuals with conditions such as obstructive sleep apnea, where the tongue and soft palate can collapse backward, obstructing the airway. The pillow between the legs also aids in reducing any hip or lower back strain. Number 3, lying on your back with your head elevated and a pillow between your knees. Combining the benefits of back sleeping and head elevation, this position allows for maximum lung expansion. Elevating the head makes it easier for the lungs to fill with air, and placing a pillow between the knees while on your back ensures the spine remains in a neutral position. This minimizes stress on the lower back and facilitates more relaxed breathing. This posture can be helpful for those with certain respiratory conditions or those who experience shortness of breath due to heart issues. Now, let's talk about the causes of shortness of breath while sleeping. Shortness of breath while sleeping can be distressing and might indicate an underlying health condition. Several potential causes include sleep apnea. The most common form, obstructive sleep apnea, involves the throat muscles intermittently relaxing and blocking the airways during sleep. Central sleep apnea, on the other hand, happens when the brain fails to send the proper signals to muscles that control breathing. Heart failure. Fluid may accumulate in the lungs when the heart doesn't pump blood efficiently, causing shortness of breath, especially when lying down. Asthma. This inflammatory lung disease can cause the airways to become narrow and inflamed, leading to breathing difficulties. Nocturnal asthma specifically refers to the worsening of asthma symptoms at night. COPD. This group of lung diseases, including chronic bronchitis and emphysema, can cause breathing difficulties, particularly during the night. Pulmonary edema. This condition involves excess fluid in the lungs, making it harder to breathe. It can be caused by heart conditions or other factors. Panic disorders and anxiety. Panic attacks or high anxiety levels can cause hyperventilation and a feeling of breathlessness, sometimes waking individuals from sleep. Gastroesophageal reflux disease. Stomach acid can flow back into the esophagus while sleeping, leading to symptoms like coughing, choking, or shortness of breath. Pulmonary embolism. A sudden blockage in one of the pulmonary arteries in the lungs, typically due to blood clots, can result in sudden and severe breathlessness. Pneumonia, which is an infection that inflames the air sacs in the lungs, can cause difficulty in breathing, especially when lying down. Pleural effusion. This condition involves the buildup of fluids between the layers of tissue that line the lungs and chest cavity. Neuromuscular disorders. Conditions like ALS or muscular dystrophy can weaken respiratory muscles, leading to breathing difficulties. But remember, it's essential for anyone experiencing shortness of breath while sleeping to seek medical advice. A healthcare professional can provide an accurate diagnosis and appropriate treatment recommendations. But as previously mentioned, choosing the best sleep position for breathing problems is essential to ensure a restful night's sleep and alleviate respiratory distress. This involves evaluating the underlying condition. For example, people with obstructive sleep apnea often find relief when sleeping on their side. This position can prevent the tongue and soft palate from collapsing backward into the throat, which blocks the airway. For individuals with chronic heart failure or pulmonary edema, elevating the head and torso can be beneficial. This incline helps prevent fluid from accumulating in the lungs, thus aiding in easier breathing. For those with conditions like asthma or GERD, elevating the head can reduce the chance of acid reflux, which can trigger asthma symptoms. It's also recommended to avoid sleeping on the back, as this can exacerbate reflux. Selecting the best position requires trial and error. Experiment with different positions to find which one feels most comfortable and eases your breathing difficulties. Some people benefit from specialized pillows or adjustable beds that allow for a customized incline. While choosing a position for breathing comfort, it's equally essential to ensure spinal alignment to prevent other musculoskeletal issues. For side sleepers, placing a pillow between the knees can help. For back sleepers, a pillow under the knees can relieve pressure on the lower back. Be sure to choose hypoallergenic pillows and bedding, especially if your allergies exacerbate your breathing issues. Regularly clean and replace them to reduce allergen exposure. If you're unsure about the best position or if the adjustments don't seem to help, consult with a healthcare professional or respiratory therapist. They can offer guidance tailored to your specific condition. For severe cases, a sleep study might be recommended to monitor and analyze your breathing patterns during sleep. If positioning alone doesn't help, you might benefit from CPAP or BiPAP machines for conditions like sleep apnea. You should also ensure that your bedroom is well ventilated. Using air purifiers can help reduce allergens, while maintaining a comfortable room temperature and humidity level can also assist in easing breathing problems. By paying close attention to your body and understanding the cause of your breathing problems, you can optimize your sleep position for a better night's rest. Always prioritize comfort and consult a professional for persistent issues. If you want to support the channel, please like and subscribe. I would greatly appreciate it. And there should be some other helpful videos popping up on your screen right about now that I think you will enjoy. And just a quick reminder, we are not doctors. This video is for informational purposes only. Thank you so much for watching. Have a blessed day. And as always, breathe easy, my friend.